Good afternoon. Ako po si Dr. Aila Velasco-Jambalos, Internal Medicine ng Lorma Medical Center. Magdi-discuss po tayo tungkol sa dengue. Ang dengue is the fastest spreading vector-borne disease in the world. Almost half the world's population, about 4 billion people, live in areas with risk of dengue. And each year, up to 400 million people get infected with dengue. 100 million people get sick from infection and 40,000 die from severe dengue. It is endemic in 100 countries, including the Philippines. From January 1 to July 2, 2002, there were recorded 65,190 cases, 83% higher than cases logged in the same period in 2021. Most of the dengue cases were recorded in Central Luzon, Central Visayas, and the Zamboanga Peninsula. There were 274 deaths reported worldwide from January to June 2002. Dengue virus is transmitted by the day-biting Aedes aegypti mosquito and the Aedes albopicus mosquitoes. They typically bite during that period of 2 a.m. to 10 a.m. and usually the female mosquitoes containing the eggs. Dengue virus has 4 serotypes: DEN V1, V2, V3, and V4. Usually, the first infection is non-severe asymptomatic, while the succeeding infections may cause severe dengue. Ibig sabihin, kapag nagkaroon ka na ng dengue noon, most probably, ang susunod na dengue infection ay mas severe na compared sa naunang dengue infection. 1 in 4 people infected with dengue will get sick. And for people who get sick with dengue, symptoms can be mild or severe. Mild symptoms of dengue can be confused with other illnesses that cause fever, aches, pains, or a rash. So it usually need to be differentiated from other diseases such as the common flu, COVID infection, and other symptoms that would show fever, aches, and pains or rash. Symptoms of dengue typically last 2 to 7 days, and most people recover after about a week. So some symptoms are eye pain, sakit ang likod ng mata, fever, sakit ang kasukasuhan, sakit ang ulo, sumasakit ang tiyan, nagsusuka, sakit ang mga buto-buto, at nagkakaroon ng rash. The rash of dengue can be pruritic, can spread throughout the body, but not painful. Severe dengue can be life-threatening within a few hours and often requires care at a hospital. It can cause shock, internal bleeding, and even death. So as I've said earlier, if you have had dengue in the past, you are more likely to have severe dengue. Some warning signs are also observed when you have a dengue infection. These would include abdominal pain or tenderness, sobrang sakit ng tiyan, sobrang hapde, madalas magsuka, kakaroon ng panalaki ng tiyan, magkaroon ng bleeding from the gums, tatain ng maitim, ng may dugo, o pag-ihi ng pula. Yung mga ibang kaso, pwede ding magtulog o maging restless. Some warning signs would also present with liver enlargement or makikita din ito sa blood picture, such as increasing hematocrit or bumabagsak na platelet count. There is no specific medicine to treat dengue. If you think you have dengue, see a healthcare provider. Tell him or her about your symptoms or history of travel. Rest as much as possible. Drink plenty of fluids to stay hydrated. Drink water or drinks with added electrolytes. Take paracetamol to control the fever or relieve pain. The DOH has also provided us with the 4S strategy. 4S meaning search and destroy, seek early consultation, self-protection measures, and say yes to fogging only during outbreaks. So we need to clean up our environment. Once we see body of water containing larvae, we need to dispose of them. We need also to take care of ourselves. We can use lotion to protect ourselves, use screen in our homes, and kulambo or mosquito net. Fogging as needed, which will be provided by the LGU. And of course, to seek consultation once with the symptoms. Thank you for listening. Good day. This is Dr. Aila Velasco-Jambalos.